Hello, everyone. Today, we're talking about pancreatic cancer. Pancreatic cancer recently diagnosed in our former president, hitting the news top 10, being the big news of the week. And other celebrities being recently diagnosed with different kinds of disorders and health issues. King Charles even diagnosed with cancer only a while back. And yet, only now is it that we're hearing about these different kinds of cancers and the kind of things going on. Because it seems people forgot that normal people also get cancer. So, with that said, we're going in on cancer and other health issues affecting our men. Hello and welcome to the Glass Floor. This is a podcast about gender equalism and different male and female issues and looking at our glass floor and glass ceiling. As we discussed in the last episode, this concept is around the idea that there is this glass floor that women stand on that is the ceiling for some of our harder working men. This is a podcast sponsored by NCFM, the National Coalition for Men, which was founded in 1977. They are a nonpartisan, gender-inclusive group which support fighting against the discrimination against boys, men, and the families that care and love them. And with that, we are going to get into today's episode. This is my guest speaker, Tim Goldich, who is the president of NCFM Chicago, vice president of NCFM. And we're going to go over some of the statistics and interesting wording and ways that over the years it seems health issues have been forgotten when they affect men.
Yeah. Thank you, Katrina. This is Katrina Overfield, co-host of the podcast. And so I wrote a book called Loving Men, Respecting Women, The Future of Gender Politics. It was published back in 2011. So I've done a lot of research over a long period of time. And I scrambled to gather up some information for this podcast. So I Google it. I ask, what is the funding? What is the federal funding for men's health versus women's health? And the first sentence that comes up is, in the U.S., research funding for diseases primarily affecting men is significantly higher than for those affecting women. And that didn't seem like anything I'd ever seen before. Next sentence. For example, the National Institute of Health, the NIH, spends roughly 6% of its research budget on men's health and 14% on women's. Well, that's rather contradictory, isn't it? This disparity leads to women paying more out of pocket for healthcare and facing inequities in research and treatment. So they repeat this. Diseases affecting men receive roughly twice the funding compared to those affecting women. And then, again, the NIH allocates roughly 6% of its research budget to men's health, 14% to women's health, resulting in what they say is a significant difference in funding. Well, yeah, I would say it's twice the funding for women. And by the way, the other 80% is for men and women, right? Because for humans, because mostly all this overlaps, right? All right. So very, very strange. In my judgment, it's even Google, even a computerized research system, has all of this political correctness, all of this feminism built into it. It says here, similarly, cardiovascular disease, the leading killer of women, receives limited funding for research specifically focused on women? Well, cardiovascular disease, the leading cause of death for humans, right?
Mm-hmm.
And of course, it's a limited amount of funding specifically toward women. What's it going to be? A unlimited funding toward women? And men die younger in larger numbers of cardiovascular illnesses. And then feminism will say something like, among people in their 80s, more women than men die of cardiovascular illnesses. Come on. I mean, that's because most of the men are already dead.
Yeah.
So this is what we're up against. If you want to try and focus some attention on men's health issues, these are the biases that we're up against to try and do that. Yeah, so only these very famous men get any attention. But pancreatic cancer, I don't have the figure in front of me, but I remember in passing that was more men than women were dying of pancreatic
Pancreatic
cancer.
cancer,
Yeah.
Statistic I found was it's 11.3 for to every 100,000 for white men, 15.4 to every 100,000 for black men, and I believe it was about 10.5 for Latino men
Uh-huh.
out of every 100,000.
Yeah. Did it say what the figure was for women?
I didn't get to see that by any chance, but I'm aware it's a lot lower.
Uh-huh. Probably. Probably because, as far as I know, it might not be up to the minute, but last I looked into it, 12 of the 15 leading causes of death more prominent for men.
Than they are for women,
Yeah.
yes.
Dying younger and larger numbers.
Mm-hmm.
Just about the only cause of death that women suffer more than men is old age.
Mm-hmm.
So,
I mean, the statistic may have changed now, but back in the day, it was said that the average years that a woman lives longer than men is 5 years.
that's right. So, another one is last I knew, what? Breast cancer received 4 times the federal funding,
Mm.
at least 20 times the private sector funding, as compared with prostate cancer.
Mm.
And at least according to some sources, prostate cancer now claims more lives. And I remember back in the 1990s, it was almost 7 times the funding.
Wow.
Yeah. So, doubtless, some of the decrease in breast cancer deaths is due to the much greater funding it received
Mm.
for research and prevention.
Mm. Which is a wonderful thing that it's been able to reduce the numbers so much.
Of course, yeah, sure. Yeah,
However,
obviously
that,
don't begrudge that.
yeah.
Right, it's just, is it fair, right? Is it,
Mm-hmm. And is it being allocated correctly given the current medical issues coming up? And more curiously, are we going to see a pattern of more money going towards more cancers and other health issues that tend to affect men more, like pancreatic cancer, now with Biden having it and things of that matter?
But it says here, according to Google AI, advocates and researchers are calling for increased investment in women's health research to address the existing funding gap, and which is already 2 to 1 in favor of women, and promote better outcomes for women. Well, in my judgment, see, all of this comes down to instinct. It's complicated, but I mean, if you take it down to the biological floor and you look at human evolution
Mm-hmm.
all the way back to the Pleistocene. You look the hominin evolutionary. For a long time, see, proto-humans, the hominins, struggled to survive. They didn't really have much going for them. Eventually, they got to be much smarter than other creatures, but not at first, not for a long time. For a long time, they were scrawny little bipedal apes, and they were neither well defended nor fleet of foot. Most any four-legged creature could run them down easy.
Mm-hmm.
And and so, to a large extent, you see, whether these hominins were going to survive or not, it came down to a simple formula. If they could produce enough offspring to offset attrition, death by any and all causes, the population would maintain its numbers and survive.
Mm-hmm.
Um, but these hominins faced a number of uh, challenges to procreation, challenges to the right. So when these hominins came down from the trees and started walking full time, the hips narrowed in order for the legs to go directly underneath.
Mm-hmm.
This was essential in order to sort of not have that, ape like chimpanzee gait,
Mm-hmm.
Uh, so what proto-humans got out of the deal was that they got quite a lot of stamina.
Mm-hmm.
Not every creature out there can run 26 miles. Humans got quite a considerable stamina out of the deal, and they got their hands free for tool use. But it came at a cost. Hips narrow, so does the birth canal.
Mm-hmm.
The young have to be birthed earlier,
Mm-hmm.
so they'd be smaller to get fit out of the smaller birth canal. Smaller means more premature.
Mm-hmm.
The offspring are particularly fragile.
Mm-hmm.
The infant mortality rate is high.
Mm-hmm. And still is to
And
some
still
level.
is. But wow, it was very high then.
Mm-hmm.
and um, and so these are all these reproductive challenges. How, it also meant that these hominins could only have one, maybe two offspring per pregnancy, right?
Mm-hmm.
As compared with many other animals, many, many more. Um, so, what determines the total number of offspring that a species is going to have or expect to have in its next generation? Well, the total number of birthing females.
Mm-hmm.
You can double the number of males. That's not going to make any difference in the number of offspring you're going to have. You can cut the number of males in half, and it won't make any difference in terms of the total number of offspring. So if you focus just on reproductive efficiency, a female is the primary factor, and
Mm-hmm.
protecting females, doubtless there's an instinctual component. And so that goes for why women would be prioritized when it comes to health, well-being,
Mm-hmm.
longevity, safety, social services. It's only natural. And it's humans being instinct puppets, because the conditions under which these instincts were formed ended about 1 million years ago.
Mm-hmm.
So we are, but the instincts remain. And so it comes down to, what do we want? Do we want true gender equality, or do we want to just go with what feels good and it feels good because it's congruent with instinct.
That instinct that's biologically, in this case, we're saying biologically induced
Yeah,
within.
innately within.
Mm,
And it's an instinct that no longer applies and has not applied for, humans have not been in danger of going extinct
mm,
for lack of offspring for about 1 million years. Certainly, it was about 500,000 years ago that the first evidence of controlled fire comes up. And by the time humans had controlled fire, there was no way they were going to die out because, that just gave such a huge advantage to humans. And still pro-humans at that point. But yeah, it's yeah, within about 1 million years, this proto-human intelligence had grown to a point where they're too clever. They weren't going to be going out of instinct just because of predatory animals. We're not going to be,
mm.
they're too clever of spears and cooperation and how to,
Other things,
yeah.
yeah. Do you think maybe the instinct we have is affecting some of the decision making behind both the funding, the attention, the news capturing the things going on? And is that a switch then, now that we're seeing pancreatic cancer and a lot of men with health issues, male celebrities, leaders showing up in the news so much?
Well, all these famous men succumbing to these various illnesses does raise some awareness,
Hmm.
but but yes, in my judgment, everything we're seeing, including this bizarre contradiction in this Google AI, it all has an instinctual origin. Now, the computer doesn't have an instinct in it, but it does get programmed by humans with instincts.
Hmm.
And it is, my understanding is that these are very definitely programmed with bias built into them,
Hmm.
feminist bias. Yeah, I mean, I think I think humans are to a large extent controlled by instinct.
Hmm.
It's denied, and we don't like it, and we rail against that thought, but it's overwhelmingly clear to me. And part of that instinct is to protect women more than men. You see it everywhere, right? I mean, 99% of firefighters are men.
Hmm.
Who's sent off to war?
Mainly men.
Who's recruited to do the hard hazardous labor?
Mainly men.
Yeah,
Yeah.
it's men down here at the underneath the glass floor, imprisoned by the millions.
Hmm.
Um, so we have to decide as humans, are we going to go with what instinct dictates, or are we going to go with what logic dictates, what the facts dictate?
Yeah.
Are we truly going to go for a gender equality? And then it goes down a rabbit hole of what does that even mean?
Hmm.
So I advocate for what I call balanced equality rather than something that I would call unisex equality. We can do better in terms of this healthcare system. We don't have to be so imbalanced the way we are.
Hmm.
And then you see what's even worse is that,
The sneaky writing.
yeah, the snaky writing, the way that you see what this indicates to me is that we're rapidly approaching a point where feminist ideology outweighs fact, truth, logic, everything. We've been seeing this for a long time when I still remember back in the late 90s, was it? I mean,
Mm-hmm.
Peter Jennings was talking about the Civil War
Yeah.
and about the brave men and women who died in the Civil War. Well, current estimates are about 700,000 men died in the Civil War, fighting the Civil War, and about 60 women died, and pretty much they just died by accident, some stray bullet or something. I mean, they're just as dead, but there's a difference between being killed by accident versus being killed by design.
Mm-hmm.
When men are ordered to charge a machine gun nest, they're killed by design.
Yeah.
Um, or a Gatling gun, as it was back in those days. But it was not a matter. It's false. Men and women did not fight in the Civil War. The South, when it was losing, it was bringing in boys as young as 14, 13 in some cases to fight this battle, but not women.
And they even put in some of their own slaves as well
Yeah,
from the plantations.
right. Some of the slaves fought for the South,
Mm.
but not women. So, yeah, of course, you can point to the culture, and obviously the culture is involved. Of course, the culture is implicated in all this, but you can't tell me that it's purely a matter of Mr. Culture has done this.
Mm.
There's got to be something deeper going on than that. It's not credible to me that you would send off boys no stronger or more capable of fighting than grown women.
And it still
You know,
happens in some areas nowadays, some parts of the Middle East and other parts where boys
right?
are enlisted to fight,
Yes,
or at least to help in certain arduous duties.
yeah, as young as 9. Sometimes they're used just to demoralize the enemy.
Mm-hmm.
There's these men forced to shoot 9-year-old boys because the 9-year-old boys have guns. They'll shoot them.
And it's historically been the case as well. Not only, I mean, use the Civil War, the Vietnam War, there were also children as well involved.
Yeah,
Um,
and sometimes you see a grown man or 18-year-old shoots some 9-year-old boy and then has a nervous breakdown. They take out. That's kind of the plan. They'll send these boys in, and then the men who were forced to shoot them, um, they just are so traumatized that they can't function.
mhm. And that's another issue that's another health issue that's underfunded in some ways is mental health as general, but
Yeah,
mental health for men quite a bit and shelters for men.
right.
There are many DV shelters that have come about. Unfortunately, we're living currently in a time where shelters are getting underfunded right at the current moment.
Yeah, well,
Um,
yeah, like
but
everything. Yeah,
if you look at just a simple search of like women's shelters, there's quite a bit of them. You search up men's shelters, either gives you general shelters, and in a few cases there are a few male specific shelters, but not many.
right.
Or it'll just straight up take you to a youth shelter because youth shelters have to
Hmm.
take everybody.
Yeah, yeah. The way I figure it, to simplify the whole thing down, maybe oversimplify it, but for me, it kind of has huge explanatory power.
By
Uh,
everything, by the way, I should probably specify. By everything, I don't, or everybody, I don't mean like, adults and kids. They take kids, but they take kids of like all genders
yeah,
and backgrounds and things of that matter.
right. The children, yeah. So boys can get into these things, but when I say, oh yeah, so to try and it's it's the simplest way of looking at it is that men are and have always been more respected but less loved,
Mm-hmm.
women more loved but less respected.
Respected.
And that kind of covers the whole thing in a way. If you look at it, it's
Yeah. And they seem to try to keep that with the way they're wording things. And um, with that, just the disinformation,
mm-hmm.
I I would say that it's sort of a misinformation by just sneakily wording it in such a way
I
based on those searches.
I
And
know, I agree. I agree. It's a lack of accountability. And uh, I'm part of a men's organization called the New Warriors. You
Mhm.
know, where we prioritize a lot accountability for men. And when this says women spend more out of pocket for health care, with one study showing what 15.4 billion difference annually. Um, well, women's own accountability. If women are going to be going and spending money on acupuncture, you know, what were you talking about earlier? The little health shops, right?
Oh
And
yeah, the health shops with the kombucha and the homemade antioxidant drinks and things of that matter.
yeah. So various sort of holistic approaches to healthcare and so on, and all this stuff is expensive.
Mm.
And if women spend more out of pocket, it's only because they're spending on things that insurance doesn't cover.
Or partly covers is another thing.
Yeah,
And then in the US, insurance is sort of prickly about what they cover, it
that's right.
seems.
That's right. Um, yeah, and a lot of it's, that what women do is discretionary. It's um, and also you can outspend your minimum, your right. I mean, you can. There's just like I've got type 2 diabetes, all right?
Mhm.
So I'd love to get one of these permanent little, well, not permanent, semi-permanent sensors
Mhm.
to read my blood glucose
Yeah.
all the time. They won't pay for it. I could choose to buy one out of pocket, and I have a feeling that that's partly what's going on with women. They will just spend whatever it takes. They're just much more focused on health than men are.
Mhm.
What do you think?
I wouldn't disagree. I would say we're more focused on our health. And we do end up paying out of pocket for a lot of things. And that's more of a American healthcare problem, honestly,
Uh-huh.
than anything else. Um, Also, no offense, man. I've noticed they have a very, some of them, not all of them, but some of them have a bit of a gung ho attitude when it comes to health. They're like, well, I'm not dead.
Right.
And next thing you know, they are just holding back as much as they can. And also, just financially, what it costs too
Mm-hmm.
is another factor.
Yeah.
Um,
So
you know,
right, you can look at
the
it
small things
either
build
way.
up, and it's like, oh, if it looks small, it's easier to cover. But if we're talking like a surgery that's 20,000, then you're thinking a lot more on that.
Yes,
And like, is
that's
it
right.
worth it on what they do or don't cover on it?
Uh-huh. So yeah, you could judge it either way. You could look at it and say that the women are overly focused on their health, or you can look at it and say men are under focused on their health.
Yeah.
It's just a judgment, And but the point is that they're choices,
Mm-hmm.
and this women spending more out of pocket is a choice.
To a good
I
extent.
would think, right?
Yeah.
Yeah. Now there's also
There's a certain extent where it's
maternity
just,
factors.
yeah, maternity factors. And I mean, with Roe v. Wade, we saw a lot of things overturned, a lot of things changing, checkups, appointments, inability to have access to not only abortions, but to certain prenatal care,
Mm-hmm.
and certain preventative care when it comes to preventing pregnancy. And so what people don't realize as well too is those kind of women's health issues and the pill and other things, they are not only used for preventative uses, but also just for other things. Hormone
Uh-huh.
control for some women. Some women use it
PMS
because it
issue.
helps with
Uh-huh.
reducing the pain a little bit, surprisingly.
Yeah.
and they don't really discuss that, and so that tends to come out of pocket a lot, those costs, and those are very much needed costs.
Uh-huh.
So it's not all always a choice,
Hmm.
but there is more of the holistic stuff that's a choice. Also, like a while back, I worked with a company that had aesthetics, and women, of course, make up a lot more of the aesthetics consumerism than men do.
Uh-huh. Yeah.
Men
Yeah.
are
Like
increasing, but
cosmetic surgery, you mean, things like that. Sort of.
lip fillers, Botox, like the cold sort of stomach suction devices,
Uh-huh.
things of that nature. A lot more that's women than it is men. The men is increasing the male usage of Botox and other things, but a lot of that audience has been female.
Mm-hmm. Mm-hmm.
And if that's included, that's the thing, it doesn't specify either,
Right.
like what it's taking into account and what it isn't in some of those stats
Yeah.
about the amount that we were paying.
Yeah.
And
I mean, the thing is, if you just read this, it indicates that women are just completely dumped on, that
mhm,
nobody cares about women, that men are prioritized in everything.
mhm,
And not only is that false, it's also horrifically divisive. It just, all of this stuff sets the sexes against each other.
mhm,
It's all framed as some kind of a war on women perpetrated by men. And that is just emotional poison
mhm.
out there. Mm.
Yeah, and it makes, and I think that's where the funding increases too. Not only the fact that breast cancer is one of the cancers that does get diagnosed a lot more, so that is the reason it's getting greater funding. It's also just like an issue that's more well known. A lot more people are empathetic towards it.
Yeah.
Um, you know, so it's one of those things. But with the interest of what's going on right now, it's one of these things where are they going to put the money to overall cancer funding and it trickles down different ways, or what ways we're looking at it? And with the information, you've got to wonder if that's the way they worded it now. How has it been skewed over the years? And also with biases and misinformation as well. It's interesting that it's not being called out now, and yet in the past we've had issues. And at some point, at first it wasn't, but at some points it was finally called out. AIDS hugely affected men. Gay men, of course, were the
But
bigger
still
crowd,
men.
but still quite a bit of men.
Yeah.
And for the longest time, they were like, "Oh my God, it's AIDS. It's terrible. It's." I mean, Princess Diana helped with bringing away that sort of
Bringing awareness.
bringing awareness about
Hmm.
it, taking away the bias and discrimination. They were seeing that they were human again.
Yeah.
They weren't seeing them as just the disease.
Right.
But for the longest time, that was the propaganda and the misinformation being passed around about it.
But then, see, that's emblematic because, yes, it was homosexual men. So it was that aspect, it was discrimination against the homosexuals.
Hmm.
But as always, the fact that they were
For
men
men.
is lost.
Hmm.
It's like imprisonment. 95% men, but you try to engage in that conversation, it'll be immediately switched to race.
Hmm.
That it's black. It's blacks being imprisoned, but black men
Hmm.
being imprisoned. Okay, it's men.
Yeah.
Oh, another thing that comes up for me about this thing I should do is yeah, one of the snakiest of all the feminist complaints around here in health is they were saying that all that the health testing or the medical testing was being done on men, and therefore we know more about how these diseases, illnesses, and medications affect men than we
Men. Yeah.
than women. Well, isn't the caveat on that just so obvious? Yeah, it's being done on men. It's as a point of fact, it's being done on prisoners and soldiers. Been doing, and mostly black. It's the men at the bottom.
Mm-hmm.
Warren Farrell said we do most of the medical testing on men for the same reason we do most of the medical testing on rats. We don't we don't care about rats. Rats are not cute and cuddly, and we don't care. Uh,
Well, depending on the person you ask.
yeah, actually,
People
rats.
got pets.
No, it's true.
They have
Actually,
pet
rats make
rats,
great
so.
pets. Actually, but yeah. But the point is, though, that this medical testing, yes, it was done mostly on men because medical testing is dangerous. And so again, women are prioritized in terms of health, safety, well-being. No, we're not going to test experimental drugs and medical procedures on women. We're going to protect them. There was even a complaint that the crash test dummies were all men.
Men.
But what about women? They're going, don't we care about women? And I was like, well, this is nuts. It's a crash test dummy. Why were they men, all males? Well, because instinctual. It was just instinctual. It wasn't even a conscious choice. It was like if you're going to subject something to
A car crash.
car crashes over and over again, you're going to make it male. And you're not going to think about it. It's not going to reach consciousness, but it's just you're not going to put a female in there to be crash tested over and over again. See?
True.
Um,
And not that I'm the expert on this or I know, but another reason may or may not be the fact that you'll notice that insurance rates are higher for men because the statistics show that men tend to get in higher car crashes.
yeah.
So that might be another reason for it too.
Oh, that's a point. But
Test out the people who are doing it the most.
yeah, but it's a dummy. It's not a human. It doesn't really. You could put breasts on it. What difference does it make? It's just a thing.
Mm-hmm.
So it's pretty ridiculous. In any case, Um, yeah, and that's right. So
And to be honest, dummies are used as practice. Realistically, you don't even get the full experience of dummies because it doesn't show what it does to the actual autonomy of a human.
that's true. That's true.
Um,
Yeah.
on the dummy, it's like the arm swings off or something. In us, our arm doesn't come off. It's not detachable. It just sort of breaks or something if it's too hard. Or
Yeah.
you can only put a certain amount of human error when you do testing.
Yeah, well, until we're prepared to put men in crash cars,
Yeah.
we're going to have to settle for the dummies. But yeah, so again, medical testing, it really just shows our lack of empathy for men, that we subject men to these things. I've even seen footage of men being marched toward a mushroom cloud to test the effects of radiation. And yes, so if you're going to subject men to that sort of thing, then of course we're going to know more about the effects of radiation poisoning on men than on women. But it takes extraordinary hypocrisy for feminism to complain then that we don't care about women because we don't march women into mushroom clouds. It's
Yeah. And the fact that it's like, they're talking about going back again to like the stats and the sneaky wording and other things, there are these issues. And as we've been pointing out, there are real issues. We also don't know what's going into them, how these decisions are made. What's it saying? How the sausage is made. We don't know what's going into the sausage.
Yeah.
Behind the funding decisions and things like that. Some people point out some of the statistics, but then it's like, who's taking those statistics and things like that, I don't have it on me, but like I've noticed a lot more stories popping up in the last couple of years of Latino men dying at younger ages from pancreatic cancer. And more people they're starting to get a little research on more midterm effects of like vaping because of people coming in with lung complications or lung cancer. that came from that, because that's sort of a newer thing. When we've had cigarettes forever, we've known they're bad. But vapes are sort of newer, and we're now getting to the point where we're starting to get more information on that.
Yeah, all
And
negative as far as I know.
yeah, they're not. Don't vape or smoke.
Do not vape. That's what
That's
they tell us.
that's what they tell us, and it's probably for the best.
Yeah.
But it's those kind of things where it's like, what is going on to make these decisions? And then also to the mirror opposite of things, what kind of issues really are being underfunded in their end? What kind of issues are being underfunded in our end? We're talking about pancreatic cancer. We're talking about, men's mental health are underfunded. We're talking about, just a general men's EV, men's support therapy, but also just other male issues. But in women, I realize there are issues. We have natal health, maternity.
Yep.
If you ever notice, we're one of the countries actually that still has a higher rate of deaths around birth for both mother and child, even though we're
Mm-hmm.
such an advanced first world country.
Mm-hmm.
So much for that in terms
Nope.
of those kind of rates. And so it becomes sort of the question of who's making decisions, why are the decisions made, how are the decisions made, who's spreading this information or the sneaky wording, and then also, as mentioned in the beginning of this, why is this only really coming up now? Where has it been? Why wasn't it noticed before? Why has no one else been talking about these
Yeah,
patterns
well,
as much?
it certainly goes way back. I mean, Myth of Male Power, published in 1993.
Mm-hmm.
Before that was Herb Goldberg, The Hazards of Being Male.
Mm.
That's 1976. You can go all the way back to E. Balfour Bax and The Fraud of Feminism from 1913. So, yeah, why is it taking so long? Why is it taking so long for us to take a look at what I'll call the other half of gender reality? You know, why are we so averse to looking at female power and male victimization? Why are we so averse to loving men, that is, empathizing with men? And why are we so averse to respecting women? I mean, really respecting women, not as powerless pawns under patriarchy, but as powerful participants and equal partners in the human system. Why will not we would not look at that half of gender reality?
And to that, why can't we see the mirror of what our issue is and come together to solve each other's issues?
Yeah.
But we will discuss that next episode. So with that, thank you so much for watching. This has been Katrina.
I'm Tim.
And this has been The Glass Floor. We will see you next episode to discuss more on those mirror opposites.